welcome to this explainer. Okay, picture this. You're driving down a quiet, scenic road in Norway, and suddenly, out of nowhere, you come across a severe traffic accident. Literally every second counts right now, and lives are on the line. So today, we're jumping right into the exact step-by-step actions you've got to take to be that critical difference between life and death before the pros arrive.
Now, stepping up in a crisis like this, it isn't just some highly commendable moral choice. It's actually mandated by law. That's right, under Section 12 of the Norwegian Road Traffic Act, you have a strict legal duty to assist if you see an accident. You literally can't just drive past. You're legally required to notify emergency services and provide life-saving first aid to the absolute best of your ability. To keep you from panicking in what is absolutely going to be a chaotic situation, we've broken this explainer down into 5 clear phases. First, your duty to act. Second, dialing the right number. Third, assessing with ABC. Fourth, critical first aid actions. And finally, support and observation.
Let's kick things off with Phase 1, your duty to act.
Now, I know it's super easy to think, hey, technology's got this. A lot of modern cars have those fancy automatic e-call systems that ring up emergency services the second you crash. But listen, you've got to be mentally prepared to take charge manually. Systems fail, or maybe the cars involved don't even have that tech. Your active manual intervention, actually stepping out of your car, is for sure the most reliable tool at the scene. Moving right along to Phase 2, dialing the right number.
Okay, in Norway, there isn't just one magic number. There are 3 you need to memorize. Your absolute number 1 priority, 113. That's for the medical emergency ambulance. Call this immediately if anyone is injured, unconscious, or in shock. When you dial 113, you connect to the AMK center. And here's the best part. The dispatchers aren't just going to send an ambulance. They'll literally coach you through exactly what to do for first aid right over the phone.
Next up is 112, which connects you straight to the police. You've got to call them to report the accident. They're going to secure the site so nobody else clashes into the pileup, handle severe traffic jams, manage serious property damage, and, of course, investigate what actually caused the crash.
And finally, we have 110 for the fire department. You need to call 110 if there are active fuel leaks, a serious risk of fire, or, and this is absolutely crucial, if victims are physically trapped inside a mangled car and need to be cut out with the jaws of life. So, the main takeaway here, just know exactly who handles what. When you get that operator on the line, take a breath and stay calm. State your location as accurately as possible. Describe exactly what's happening and tell them how many people are hurt. And here is a golden rule you can never forget. Never, ever hang up the phone until the operator explicitly tells you to.
All right, let's look at Phase 3, assessing with ABC.
With professional help officially on the way, you need to quickly figure out who needs care first. We do this using the ABC method. A stands for airway or luftveier in Norwegian. First things first, check if they're conscious. Speak loudly, give their shoulders a gentle shake. If they don't respond, you've got a massive airway problem. If an unconscious person is flat on their back, their own tongue or even blood or vomit could literally be blocking their throat. You've got to physically open that airway by tilting their head back just a bit and lifting their chin.
Once that airway is open, we jump to B for breathing or pust. Look at their chest, listen closely, and feel for normal breathing for up to 10 seconds. If they're breathing normally but they're still knocked out, roll them into the recovery position. That's stabilisere. This uses gravity to keep the airway clear and stops them from choking. But hey, if they aren't breathing at all, you are instantly in a life-or-death scenario and it's time for immediate CPR.
And that brings us to C for circulation or circulation. You need to rapidly scan for major external bleeding, which you've got to stop fast with direct pressure. But listen, you also have to be on high alert for the hidden dangers of internal bleeding and shock. If their skin is pale, cold, and clammy, and they've got a super rapid but weak pulse, their circulatory system is failing and you need to act fast.
This leads us directly into Phase 4, critical first aid actions.
Now that you've done your ABCs, we're in the highest stakes phase. If you found someone wasn't breathing earlier, you have to perform CPR right away. Place the heel of one hand right in the center of their chest, put your other hand on top, and push down hard and fast. You want to aim for a very rapid rate of 100 to 120 compressions per minute. And those compressions, they literally have to be deep if you want to pump blood to their brain. You've got to push down about 5 to 6 centimeters into the chest. Now, if you're formally trained and comfortable doing it, throw in 2 rescue breaths for every 30 compressions. But if you aren't trained, seriously, do not freeze up. Just stick to continuous, hands-only compressions. Whatever you do, just keep pushing.
Okay, let's talk about severe bleeding. Rapid blood loss causes shock and death incredibly quickly, so follow these exact steps. Apply firm, steady pressure directly onto the wound. If it's on a leg or an arm, elevate it. Look, a clean cloth or sterile dressing is awesome, but please do not waste precious time digging around for the perfect medical kit. If the bleeding is heavy, just use your bare hands to apply pressure right then and there.
Now here's something a lot of people totally forget: the environment. The cold Norwegian ground is literally a silent killer. Trauma victims lose body heat so incredibly fast, which leads to hypothermia. And get this, hypothermia actually stops the blood from clotting, making every single injury way more dangerous. You have to insulate victims from the ground right away. Shove a blanket or jacket under them and put one over them too. And remember, even on a warm summer day, shock can cause their body temperature to completely crash. Keeping them warm is absolutely crucial.
Which brings us to our 5th and final phase, support and observation. As the immediate medical chaos sort of stabilizes, you've got to switch gears. Remember, not all injuries are physical. A traffic accident is a massive psychological trauma. If someone is awake, just stay with them. This is psychological first aid. Speak in a super calm, reassuring voice. Tell them straight up, help is on the way. Being a calm presence can literally slow their heart rate down and stop them from going into deeper physical shock.
And guys, there is one huge, overarching rule when you're responding to an accident. Do not move an injured person. Obviously, if there's an immediate catastrophic threat, like the car is literally on fire or sinking in water, get them out. But otherwise, have them stay completely still. Moving someone with a neck or spinal injury even a fraction of an inch could cause permanent paralysis. If you absolutely have no choice but to move them to save their life, try your best to keep their head, neck, and back in a perfectly straight line.
Finally, don't ever just assume someone is fine because they're awake. Conditions can change in a flash. Someone chatting with you 1 minute could completely pass out the next because of internal trauma. You have to keep a continuous eye on their breathing and alertness. Stay right by their side until the ambulance pulls up, and then you'll just give the paramedics a quick, factual rundown of what you saw and what you did.
Wow, we've covered a lot of ground today. We talked about your legal duty to act, the exact numbers to call, the critical ABCs of assessment, and the life-saving first aid you absolutely have to know. I know it's intense, but having this roadmap gives you incredible power in an otherwise powerless situation. So, I want to leave you with one final vital question to ask yourself the next time you put your keys in the ignition. If you witnessed a traffic accident today, are you truly prepared to step out of your car and be the difference between life and death?